Now, we all know when we have bad air like today, it's bad for your health. But what can you do to protect yourself? For more, we're here with Dr. Denitza Blagev with Intermountain Medical Center. Thanks for being here today.
Thanks for having me.
So let's just clarify what we had today. It was fog that was not really connected with the inversion. Is that right?
Right, exactly. So even though it looked like a blanket of stuff,
exactly.
Most of that stuff was actually humidity.
Okay.
And so sometimes looks can be deceptive. And if we actually look at the numbers, the morning the air quality was pretty good, and then in the afternoon it's more in the moderate range.
Moderate now. But we saw earlier this week that inversion was just hanging out on top of us, and you could almost taste it, it seemed like, some days as well. What is that doing to our bodies? What are some of those short-term and long-term effects?
So unfortunately, air pollution has both pretty immediate consequences, especially for people that are sensitive, so people with lung disease or heart disease, children or the elderly.
Okay.
They can get more likely to get pneumonia, more likely to get asthma attacks, more likely to get kind of airway irritation and shortness of breath. And then long-term exposure can lead to increased risk of developing asthma and chronic lung and heart disease, and even increased risk of mortality over time.
So we know that this is having an effect. We know that from all the research that we've been doing. Well, what can we do? Because we live here, you have to go outside, you have to go to work or school. What can we do to limit that exposure?
So probably the safest thing for people is to stay indoors and make sure our indoor air filters are clean so that we're breathing better indoor air. But typically the air pollution is higher outdoors than it is indoors.
Okay.
The other thing, especially for people that like to exercise and be active, which is typically great, when we have the inversion and the air pollution is high, really the best thing is to exercise indoors, because when we exercise, we breathe in deeper, we take in more of that air pollution.
I know a lot of people are worried about their kids, their health, breathing in what we have in the inversion. Schools have requirements for recess. What do parents need to know?
You know, I would say one of the best things for parents to do is not to idle when they're dropping off their children. It's kind of amazing that when you see the drop-off line, there's so many cars kind of idling in not very cold weather, and we're really poisoning our children by creating air pollution right there at the school. The other things are children that are sensitive, so children that already have asthma, the schools will follow guidelines about keeping them indoors when the air quality is a little bit bad, but not quite bad enough to have all the other children stay indoors. So I think for parents, it's the same kind of thing, trying to prevent making the air quality worse by not idling, trying to limit our trips, and then having them play indoors if we're able to.
Well, you, as a pulmonologist, you see people who come in and they are showing these lingering effects of the inversion, maybe some other things that have affected them. Are we doing better? Is the air quality getting better? Are you seeing fewer people come in? Or are you steady?
You know, it's hard to say, because with each inversion, the people that are sensitive really feel it immediately. And so the worse the inversion is, you know, I've seen a lot of patients this last week that sort of felt like when the weather turned, when the air quality got bad, they can sort of time their symptoms to that. And once they have the inflammation or kind of the asthma attack or the COPD emphysema flare, it takes them a little while to get back. Long-term consequences are less easy to measure day to day. And so those, I think, are more difficult to pick up, and that's why we end up doing studies over a larger population a long period of time.
Well, we know that the effects are there. We appreciate the research that is being done at Intermountain Medical Center. If you want to learn more about the inversion, the effects that it's having, or if you are feeling some of the symptoms during those bad inversion days, there's the website, Intermountain Medical Center. We'll put a link to that on our website at goodforyou.com. Dr. Denitza Blagev, thanks for joining us.
Thanks.